Track 3. Executive Summary. This track is approximately 10 minutes long. Executive Summary. 1. We are determined to have a welfare system that provides a vital safety net for those who need it most, whilst encouraging and supporting people into work. In recent years, the government has delivered successive reforms to create a welfare system that is fair and compassionate whilst providing value for the taxpayer. 2. We are tackling the barriers that prevent disabled people from living independent and fulfilling lives, as set out in our Disability Action Plan, published in February 2024. That means making our country the most accessible place in the world for disabled people to live, work and thrive. 3. We want to design a welfare system that is fit for the future, a system that is both fair and compassionate. However, our current disability benefit system for adults of working age is not providing support in the way that was intended. 4. Through Transforming Support, the Health and Disability White Paper 2023. We have taken significant steps to address the barriers and work disincentives within the benefit system, as we know that being in suitable work is good for people's physical and mental health, well-being and financial security. We have also invested in expanding our innovative voluntary employment programs such as Universal Support, Work Well and Employment Advisors in NHS Talking Therapies to ensure more disabled people and people with health conditions can access integrated and tailored support to help them move closer to work. 5. Personal Independence Payment, PIP, was introduced in 2013 to provide non-means tested cash payments to disabled people and people with health conditions to help them live independent lives. The intention was that PIP would be a contribution to extra costs arising from their disability and a more sustainable, dynamic benefit that would also pay greater attention to mental health than its predecessor, Disability Living Allowance, DLA. These additional costs are not defined, and claimants are able to spend the money they receive according to their own priorities. 6. In the decades since then, the nature of health and disability has changed, and the caseload and costs of the benefit have risen significantly, reflecting increasing self-reported prevalence of disability. We believe it is the right time to look again at ensuring government support for people with ill health and disabilities is focused where it is most needed. We also believe there may be better ways of supporting people to live independent and fulfilling lives, and this is the idea running through this green paper. This could mean financial support being better targeted at people who have specific extra costs, but it could also involve improved support of other kinds, such as physical or mental health treatment, leading to better outcomes. 7. There are now 2.6 million people of working age in receipt of PIP and DLA, and more UK adults now report a disability than when PIP was first introduced. Note 2. Benefit Caseload and Expenditure Tables, AS23. Benefit Expenditure and Caseload Tables, 2023, gov.uk. https://www.gov.uk/government/benefit-expenditure-and-caseload-tables 2023 and cbp-9366.pdf researchbriefings.files.parliament.uk/cbp-9366/cbp-9366.pdf. P4. Nearly a quarter of adults of working age in the UK say they have a disability or health condition which causes substantial difficulty with day-to-day activities, up from 16% when PIP was first introduced. Note 3, 2022/23, Family Resources Survey, https://stat-explore www.gov.uk/webapi/login.xhtml. This equates to 8 million people of working age in England and Wales. Many of these people, 3.7 million, say they have difficulties with mental health, and this is reflected in the caseload. The proportion of people receiving PIP and DLA with anxiety or depression as their primary condition has grown since the pandemic. In 2019, there were an average of just under 2,200 new PIP awards a month in England and Wales, where the main disabling condition was mixed anxiety and depressive disorders. This has more than doubled to 5,300 a month in 2023. 8. Costs have risen in line with this. Over the coming 5 years, PIP spending is expected to grow by 63%, £21.6 billion to £35.3 billion, 23/24 to 28/29. Note 4. Benefit expenditure and caseload tables. gov.uk. https://www.gov.uk/government/benefit-expenditure-tables. Each month there are now 33,000 people joining the benefit, around double the rate before the pandemic. Note 5. Stat Explore. 33,000 new claim normal rules awards in January 2024, compared to 17,000 in January 2020. Refer to Stat-Explore PIP clearances tables. https://stat-explore.dwp.gov.uk/. 9. We need to ensure we have a system that is sustainable and fair for all. PIP was designed as a contribution towards the extra costs faced by people with health conditions and disabilities to enable independent living. Some claimants will have considerable extra costs related to their disability, and others will have minimal costs. This green paper looks at whether there are ways we can improve how we support people, in a way that is also fairer to the taxpayer than the current system. 10. Throughout this green paper we are guided by 3 priorities. These are: providing the right support to the people who need it most, targeting our resources most effectively, supporting disabled people to reach their full potential and live independently. 11. This green paper will explore changes we could make to the current PIP system to ensure support is targeted where it is most needed. These options include making changes to the eligibility criteria for PIP, redesigning the PIP assessment to better target it towards the individual needs of disabled people and people with health conditions, reforming the PIP assessment so that it is more linked to a person's condition. 12. The Green Paper will also explore whether we should make fundamental changes to the way we provide support to disabled people and people with a health condition. We know that additional costs of having a disability or health condition vary significantly, and that for some people the current system does not meet their needs in the most efficient or effective way. We also recognise that better, more targeted support could be provided by other local services. We want to hear how the welfare system could be improved by exploring new approaches to providing support. These include moving away from a fixed cash benefit system so people can receive more tailored support in line with their needs, moving towards a better join-up of local services and a simpler way for individuals to access all forms of support and care whilst reducing duplication, to better meet the needs of people with health conditions and disabilities. Exploring alternative ways of supporting people to live independent and fulfilling lives. This could mean financial support being better targeted at people who have specific extra costs, but it could also involve improved support of other kinds, such as physical or mental health treatment, leading to better outcomes. 13. We want to hear from you about the approaches we should consider. Crucially, we want your views on whether we can achieve our ambition within the current structure of health and disability benefits or whether wider change is needed. 14. We will always support those who need it. Throughout this consultation, we will continue to listen to and work with disabled people, people with health conditions, and their representatives to reach these important goals. Responsibility for health and disability benefits lies with both the UK Government and devolved administrations. We will continue to work with the devolved administrations to consider the implications of the proposals in this Green Paper in Scotland, Wales and Northern Ireland. This concludes Track 3.